Rheumatoid arthritis and other autoimmune diseases affecting the joints. I want to give you a high-level overview of rheumatoid arthritis and other autoimmune disease conditions that affect the joints, such as ankylosing spondylitis, lupus, psoriatic arthritis, reactive arthritis. Autoimmune disease occurs when the body produces T and B lymphocytes that attack the body's normal tissues. Now, T and B lymphocytes are part of the body's normal immune system. But why T and B lymphocytes begin attacking the body's own tissues is still a bit of a mystery. But this behavior can be triggered by genetic factors, environmental factors, the use of certain drugs, and by having certain infections. Now, sometimes the lymphocytes attack just one tissue exclusively, as would occur in Hashimoto's thyroiditis, which only attacks the thyroid gland. And sometimes in autoimmune disease, the T lymphocytes and B lymphocytes are actually attacking a host of different tissues at the same time. But one common denominator in virtually all autoimmune diseases that affect the body's joints involves the overactivity of macrophages. So what are macrophages? Macrophages are one of the body's white blood cells that starts out in life as what's known as a monocyte after being produced in the bone marrow. So monocytes are one of the white blood cells that you would see on a blood panel. And then once monocytes are released from the bone marrow, they take up residence throughout the body in different tissues, and then they morph into macrophages. So there are macrophages that sort of line the inner tissue of our joints. Some macrophages are in our bone, where they're called osteoclasts. Some of them are present in our organs like our kidneys and in our lungs. Some are even in our liver, some are even in our skin. Now, in autoimmune diseases that affect the joints, macrophages secrete high doses of powerful inflammatory chemicals like tumor necrosis factor alpha, interleukin 12, interleukin 23, interleukin 1. These chemicals cause significant inflammation, lead to bone destruction, and sometimes sort of proliferation of bone, leading to bony bridges between bones, as occurs in ankylosing spondylitis, as well as increasing the synthesis of fibrotic tissue, forming nodes and nodules. So this leads to inflammation, pain, progressive loss of mobility, and increased rigidity, as well as joint destruction and deformities. And the release of inflammatory and fibrosis-promoting chemicals, these things that we call cytokines, by macrophages, can also cause progressive damage in the kidneys and the lungs, which can lead to decreased organ function over time. You get a decline in pulmonary function and kidney function. Not good outcomes. So the good news is that certain drugs have been developed which tone down the effects of macrophages and some of their inflammatory chemicals. Now, these drugs are now a standard method of care for various autoimmune diseases. But the other piece of good news is that studies show that certain dietary, supplementation, and lifestyle practices can also help to tame macrophage secretion of inflammatory chemicals and reduce other aspects of the inflammatory process. And these things may even help to stop or slow the destruction of joint cartilage. So in the accompanying feedback report, you're going to find the nutrition and other proactive strategies that may help to improve the management of your autoimmune condition. I've also included the scientific references in case you wish to do any further reading on any of these subjects. So I hope you'll find this information to be illuminating, inspiring, and helpful. Your proactive involvement in the management of these conditions can sometimes have a very significant impact on the course of the disease. So I hope you'll take a serious look at these lifestyle considerations. Now, remember to speak to your doctor first before making any dietary, supplement, or lifestyle changes that may affect the course of your condition. So thanks for watching.